Hello everyone, welcome back to my channel Xgene and proteinX. In this tutorial video, I'm going to talk about some important parameters of pharmacokinetics. Mainly some basic overview of some important parameters of the pharmacokinetics. Let's begin. So the pharmacology, it has two different fields. One is pharmacokinetics that describes the absorption, distribution, metabolism and excretion of the drug. So in short, it is known as the ADME. So drug first absorb, then distribute, enter the body, and then metabolize in the liver, and then excrete through the kidney. And the another term is the pharmacodynamics. So it describes how biological processes in the body respond to or are impacted by a drug. So this is very much common and well-known plot, that is the plasma concentration versus time. So in this figure, it indicating that the drug plasma concentration it increase over time, but there are certain point that is known as the cmax or peak plasma concentration. So this point is the peak plasma concentration, so or cmax. So it means that the maximum observed concentration of the drug. So this point is the maximum concentration of the drug in the plasma, and this is the tmax. And here, as you see in this figure, that from the cmax, the corresponding straight line it indicating the tmax, and tmax is the time it takes to reach the maximum concentration or cmax. And this curve is known as the AUC or area under curve. So actually this AUC stands for area under curve, and it represents the total exposure of the drug. So you see this curve, so this total curve, so this is total curve is it represent by the AUC, and also it describes the total drug concentration over time. And here there is one straight line, and it indicating the desired response, or also it is also known as the minimum effective concentration. So minimum effective concentration or MEC or the desired response is the minimum plasma concentration of a drug needed to achieve sufficient drug concentration at the receptor to produce desired pharmacologic response. So this is the minimum concentration to achieve therapeutic response. And here there is one term that is known as the duration of the action, and duration of the action, that is it represents the length of the time that particular drug is effective. So also it is known as the onset of action, or how long one drug it effective and it gives the therapeutic response, that is known as the duration of the action. And next is the subtherapeutic, and as you see in this figure that this is the under desired response. So it's very common that is easily you can understand that this what is subtherapeutic dose. So mainly the subtherapeutic dose is the that does not achieve a particular therapeutic effect, because this is the below concentration of the minimum effective concentration. And next is the another straight line you see here, that is just over cmax or peak plasma concentration, and it represents the adverse response. So adverse response is basically the unwanted, undesirable and unexpected effects that possesses by drug. So here this is the minimum effective concentration, and here is the, you can consider that is the maximum effective concentration. So when it just touch this adverse response straight line, then the drug it shows some adverse effect. So next is the the therapeutic window. So as I said earlier that minimum effective concentration and maximum effective concentration. So when you draw a line here, so it known as the therapeutic window. So mainly this is the dose range of a drug that provides safe and effective therapy with minimal adverse effects. So when the drug dose it range in this point, so in this field actually in the therapeutic window, then it possesses actually the safe for use and it does not show very higher adverse effects. And next is the adverse effect. So when the concentration of the drug that cross this maximum effective concentration or the adverse response, then that drug shows the adverse effect. So mainly the adverse effect is an undesired harmful effect resulting from a medication. So next is the bioavailability. So bioavailability is a term that used to indicate the proportion of a drug absorbed into the systemic circulation. So here the systemic circulation is the entire bloodstream. So for example, let me write here. So for example, like if any patient administered around 160 mg per ml any drug orally, then the bio, the part or the proportion of the drug that absorbed or it comes in the bloodstream, or how much proportion of that drug that available in the bloodstream. So if you consider that around 90 mg per ml of this drug it's available in the bloodstream, so it means that for that specific drug the bioavailability is 90 mg per ml if it taken by orally. And always remember that for the IV intravenous dose the bioavailability is 100%. So it means that the drug it injected directly to the bloodstream, so all of the drugs are available in the bloodstream, so that's why the bioavailability for IV is 100% always. And always like orally taken drug, this is very lower bioavailability. And next is the bioequivalence. So bioequivalence, this is a term that describes a comparison of the bioavailability of two or more drug products. So mainly this kind of bioequivalence, this is actually applicable for clinical trial experiments. So when there are two different kind of drug, like drug A and drug B, and if you would like to compare the bioavailability of these two drugs, then you need to use this term, the bioequivalence. So mainly like if you have any drug like A, it has some existing bioavailability and you want to modify the bioavailability of this drug, then you need to do the experiment, or you have to do the clinical trial experiment to check the bioavailability. All right. So next is the plasma half-life. So the plasma half-life actually you see in this figure, this is very much clear, and this plasma half-life it refers to the time required for plasma concentration of a drug to decrease by 50%. And And so here, so in this plot, this is the plasma concentration and this is the time. So the plasma concentration is 100 if you consider, then if it decrease to 50%, and then for 50% decrease of the drug, how long it take to decrease the 50%, and that time is known as the plasma half-life. So if you like 50% and if you corresponding straight line if you draw, then it's showing the 1 hour according to this plot. So this, for this specific drug, its plasma half-life is 1 hour. So in 1 hour it decreased to 50% the concentration, and again this drug from 50 to 20% it decreased from according to the corresponding straight line, so it means 2 hours. So it takes 2 hours to decrease 25%. Alright, and there is a formula, the half-life, that it calculating like 0.693 into volume of the distribution and divided by clearance. So by this formula you can calculate the plasma half-life. And also there are another formula, that is the T half equal to 0.693 divided by lambda. Lambda is the constant and need to be estimated. Alright, so I hope this video will be helpful. Please, if you think that this video is helpful, please subscribe my channel and like it and share. And if you have any queries, kindly write in the comment section. Thanks.